Alexander Scott, who couldn't be here. But I must confess that I was extremely happy that she couldn't be here. And if you could have guessed by my name, you probably guessed by now by my accent, I am one of these people. I am an immigrant. I came to the United States as an adult. My children, I have 4 children, all of them were born outside of the United States. So this is personal, and it has been personal from the first day I got to the United States. So she couldn't keep me here, but even if she could, I would have asked her not to, and to let me be the one here. So it's personal, but it's also reflective, I believe, of the commitment that as a department we've made a long time ago to the immigrant community in Rhode Island. It has been at the core of our values, at the core of our engagement with our communities and with the providers that we have. A quick example is we mentioned charity care regulations and the charity care benefits that exist in our state. Those were passed many, many years ago. And at that time, when we passed the charity care regulations, we made it a point to put in legislation that those benefits were for everyone who was a resident of the state, regardless of their legal status. Those were easy steps that we could take at the time. Maybe people were distracted, they didn't realize. But those are the law, and those are protections that we put in place. But that's a small example. Small, but who has extremely great benefits, because our charity care regulations is not just about emergent care. It's about all services that are routinely provided by a hospital under a hospital license. So it really encompasses a bunch of very much broad services that people don't necessarily think about. So some of the things that we're doing, it's trying to remind people of those rights around services. Remind providers and hospitals about what their obligations are towards our citizens that are the most vulnerable citizens in our state. We've been partnering with the Immigrant Coalition for quite a few times. They came to the department, I believe last spring, bringing those concerns and asking us, what can you do, or what should you do? I would say even more important. And so we listen, and we are working with the Immigrant Coalition and partners to change a few things. As Linda mentioned, we secure some funding from the Kreisky Foundation to develop new educational materials around access to care and around benefits, and we'll be doing that in a multitude of languages. We made sure that when last year we had our Health Equity Summit, that we had Linda and a group of other key partners and stakeholders to be at the table and have a panel discussion during the summit around immigrant rights and concerns. And that was one of the most well attended, in fact, rooms. The room was packed, which is a sign of how important it is for our state, but also how concerning. We did, as a department, when there was the public charge rule, we did officially provide comments as a department, but we also encourage our stakeholders, as many of you here, our partners, to provide those comments themselves, and we do hope that they would the federal government fulfill their obligation and look at those and respond as they are required by law. And if not, we are willing, as everybody else, to step again and call them on it. We are at this time we are reviewing all of our educational materials in trying to make them more relevant to the current times that we are living. We are looking at our charity care materials that we have. We are looking at our cultural and linguistic appropriate service information that reminds providers of the right, the obligation to provide services in a language that is understood by the patient and the person receiving the services. Those are things that we do and that we can do. The other things that we're doing as with DHS, we are working with our staff, providing them the appropriate information, making sure that they understand the complexity of the situation and the danger that exists right now, felt, real, or perceived for our community. And so we have a social justice roundtable group, internal group discussion that has been talking about these issues and will continue to address them as a forum where the staff can come and have those conversations. We are reminding our staff that our programs, thankfully, none of them require a question around citizenship or legal status. All of our public health programs, we're talking about the WIC program, family home visiting programs, HIV testing and screening, women's cancer screening program, all of those are programs that people have access to without any question needing to be asked about, do you have a social security number? And so, reinforcing that message and reminding folks, and as Director Cox talked about, making sure that our forms, when it's not necessary, is not asking for information that then raises anxiety and fear. It's something else that we are taking a critical look right now, going back and looking at all of those and saying, are we asking only what we need to ask and not what people may want to ask? That being said, as a department, regardless of our deep commitment to the community that we serve, of our stated value of achieving equity, which is really making sure that every single one of us and every Rhode Islander, regardless of the language that they speak, the accent that they have or do not have, the color of their skin, that every single one of us has the same equal chance and opportunity to achieve their best outcome in life. We ought to do that together. We do not do it together. So thank you for being there with us. Thank you for challenging us every single day. That's your job. That's what we expect of you. And that's our job to then respond appropriately. So keep at it, and keep challenging us, and hopefully we will respond.